Hey Big Fish family, I've got a great analogy that you can use, and I've been using this one for years. And this has to do with the fact that some people, in fact a lot of people, have a reduced curvature in their neck, or their neck is real straight. Instead of having that nice curve, they've got a real straight neck, or maybe it's even reversed and bent the wrong direction. And so this is a really good analogy to use when you see that. And so what I want to do is I want to show you your spine. So I'm going to talk to you as if I'm talking to the patient right now so that you can incorporate this analogy. Now, here's your neck, Susie, and your neck is really straightened. And so what's happening is that instead of having that nice curvature in your neck, you have a really straightened curvature, and that's not normal. It's normal to have a nice curvature. It's called a lordosis in your neck. And you don't have that because the alignment in your neck is poor. Now, what's so important about this? Well, when you do not have that curvature in your neck, what is happening is it's taking your spinal cord, which is gray matter and white matter, just like your brain. It's literally brain tissue, and it's taking that cord and it's stretching it. Now, there are some things that love to be stretched. Muscles love to be stretched. Ligaments, tendons, they love a nice good stretch. Nerve tissue hates it. Nerve tissue hates being stretched and responds really poorly to being stretched. And so another thing I want to show you is this. If you look at my hand, the skin on my hand, when it's in this nice curved position, the skin on my hand is nice and loose. And that's how the skin is healthy, when it's nice and loose like this. What is really horrible is when all of a sudden the nice curve is gone and it's straightened, and now maybe even reverse the opposite direction, and what you see is that the skin on my hand is being stretched. Now, they've done studies on this, and what they have found, and these studies were actually funded by attorneys, that were proving the fact that in a whiplash, which creates that real straight spine or a reverse curve in the spine, in the neck, when there is whiplash, the stretching that happens to the spinal cord stretches the spinal cord by an average of 1.5 inches. So your spinal cord is literally being stretched 1.5 inches, which does damage to it over time and in the immediate time. So it is really important that when we see a curvature that is inappropriate, where it's stretching the spine, that we bring curvature back into the neck to give a nice, easy, comfortable way for the spinal cord to sit inside of that canal. That is really important. And so getting that curve to change is a part of correcting alignment and getting you functional again. So using this analogy of the skin on your hand is an important one for you to be able to connect with the patient so that they understand more comprehensively and they can really engage in the activities that you're going to ask them to do to change their life. Thanks, Big Fish. We'll talk to you soon.